There are 5 medications sitting in medicine cabinets across this country right now. They were prescribed by well-meaning doctors. They treat real, legitimate conditions. And for millions of seniors over 65, they are quietly, methodically draining the very strength, balance, and mental sharpness that makes independent living possible. A large-scale analysis published in a leading clinical pharmacology journal found that nearly 40% of adults over 65 are taking at least one medication with a significant risk of functional decline. Muscle weakness, increased fall risk, cognitive impairment, or dangerous nutrient depletion. In most cases, the patients had no idea. That is what today's video is about. The goal here is not to frighten anyone, and it is certainly not to tell anyone to stop taking anything. That decision belongs to you and your doctor. What this video is going to do is hand you specific, research-backed information, the kind your pharmacist probably never had time to explain, so that you walk into your next appointment armed with the right questions. Here is what makes medication number 1 so alarming. It is one of the most prescribed drugs in the world. It has been called safe for long-term use, and according to a formal safety communication from the FDA, it may be silently robbing your bones and muscles of the mineral they need most. Millions of people taking it have no idea. Stay with us. Every item on this list matters. By the end of this video, you will know exactly which 5 medications are most likely to cause hidden weakness and decline in seniors over 65, what the research actually says about each one, and the precise questions to bring to your next doctor's visit. The number 1 medication on this list will likely surprise you, and it may already be in your daily routine. Before we get into the list, drop a comment right now and tell us where in the world you're watching from and what time it is there. This community spans every corner of the globe, and we genuinely love seeing that. Let us know. Number 5. Beta blockers. Beta blockers, medications like metoprolol, atenolol, and carvedilol, are among the most widely prescribed drugs for high blood pressure and certain heart conditions. They do their job. They slow the heart rate, reduce blood pressure, and protect the heart muscle from overwork. But for adults over 65, there is a dimension to these medications that most patients are never told about at the time of prescribing. Our research consistently shows that beta blockers reduce the heart's maximum output during physical exertion. That sounds technical, but the practical meaning is this. Your body becomes physically incapable of reaching the exercise intensity levels needed to maintain and build muscle. You can walk, you can move, but your cardiovascular ceiling is being lowered by the medication itself. A large-scale study involving older adults on long-term beta blocker therapy found that participants showed significantly reduced aerobic capacity, in some cases equivalent to the functional profile of someone a full decade older. This matters enormously because after 65, preserving muscle is not a fitness goal. It is a survival strategy. Every pound of lean muscle mass lost increases fall risk, slows metabolism, and reduces the ability to recover from illness or surgery. The second documented issue is fatigue. A 2020 meta-analysis published in the European Heart Journal found that persistent fatigue was reported in up to 18% of older patients on beta blocker therapy. And in the vast majority of cases, it was attributed by both patients and physicians to the natural process of aging rather than the drug itself. That misattribution has consequences. When fatigue is chalked up to age, patients stop exercising. When patients stop exercising, they lose more muscle. The downward spiral is real, and it is preventable. What to discuss with your doctor. Ask whether your current cardiac or blood pressure indication specifically requires a beta blocker, or whether an ACE inhibitor or calcium channel blocker might achieve similar results with a different side effect profile for your age. Also, ask about timing. Some cardiologists now recommend taking beta blockers in the evening to reduce daytime fatigue. These are straightforward conversations that can meaningfully change your quality of life. Number 4. Long-term corticosteroids. If you have been prescribed prednisone, methylprednisolone, or any oral corticosteroid for conditions like COPD, rheumatoid arthritis, inflammatory bowel disease, or lupus, this section is critical. Corticosteroids are powerful medications. In acute situations, they can be genuinely life-saving. But their long-term use in seniors carries consequences that the research community has documented thoroughly, and that many patients are not warned about in sufficient detail. The first is bone density. It is well established in the medical community that long-term corticosteroid use is one of the leading causes of secondary osteoporosis in older adults. Recent research involving adults over 65 on oral corticosteroids for more than 90 consecutive days found a fracture risk more than 2.5 times higher than age-matched peers not on the medication. The spine and hip, already the most vulnerable structures in an aging skeleton, bear the disproportionate impact of this bone loss. The second is muscle wasting. So corticosteroids trigger a condition called corticosteroid-induced myopathy, a documented process in which the medication directly interferes with muscle protein synthesis. The muscles most affected are the large, load-bearing muscles of the thighs and upper arms, the exact muscles needed to rise from a chair, climb stairs, and maintain balance. A large-scale study published in a leading rheumatology journal found that 60% of patients on long-term oral corticosteroids showed measurable reductions in muscle mass after just 12 weeks of continuous use. The third is blood sugar dysregulation. Corticosteroids raise blood glucose levels significantly, and in older adults, this can accelerate the type of insulin resistance that further undermines muscle metabolism and energy availability throughout the day. What to discuss with your doctor. If you've been on oral corticosteroids for more than 8 weeks, ask about the possibility of transitioning to inhaled or topical formulations where your condition permits. Ask specifically about calcium and vitamin D supplementation. Both carry meaningful evidence for mitigating corticosteroid-related bone loss. Ask whether your dose can be tapered to the minimum effective level. These are not confrontational questions. They are exactly what an informed patient should ask. Of course, everyone's health situation is different, so always discuss any changes with your healthcare provider before making them. Number 3. Benzodiazepines. This is where the conversation becomes genuinely urgent. This class of medication is responsible for a staggering and largely preventable amount of harm in adults over 65, and the mechanism behind that harm is not widely understood by the people taking these drugs. Benzodiazepines, medications like diazepam, lorazepam, clonazepam, and alprazolam, are prescribed for anxiety, insomnia, and muscle spasms. They work by enhancing the effect of GABA, a calming neurotransmitter. In younger adults, that mechanism is effective, and the drug is cleared from the body within a reasonable time frame. In adults over 65, the pharmacology changes in a way that most prescribers do not communicate clearly enough. The reason is hepatic metabolism. As the body ages, the liver's ability to break down certain medications slows significantly. A drug that a 35-year-old clears in 4 hours can take a 68-year-old 12 to 18 hours to process. This means benzodiazepines accumulate in the body of an older adult at levels far higher than intended, and they stay there. The sedative effect doesn't end when the pill wears off. It layers, day after day. A large-scale prospective study involving over 3,000 seniors followed for 6 years found that those on long-term benzodiazepine therapy had a 51% higher risk of developing Alzheimer's-type dementia compared to non-users. This finding has been replicated across multiple independent studies published in leading neurology and geriatric medicine journals. The relationship between long-term benzodiazepine use and cognitive decline is no longer a fringe concern. It is a documented clinical risk. The fall data tells an equally serious story. Medical experts consistently identify benzodiazepines as one of the top 3 contributors to fall-related hospitalizations in adults over 65. The mechanism is twofold. These medications impair balance and coordination directly, and they slow reaction time, meaning that when a foot catches a rug at 2 a.m., the body doesn't recover fast enough to prevent a fall. This is where we want to introduce Ruth. Ruth was 68 years old, a former school librarian from Vermont, when she first started taking lorazepam for anxiety following her husband's death. Her doctor prescribed it as a short-term measure, 2 weeks, no more. That was 4 years before her story came to us. The prescription had simply been renewed at every checkup without reassessment. Ruth described feeling foggy all the time, and she had quietly stopped driving because she no longer trusted her own reaction time. She had fallen twice in 18 months, both times inside her own home. Her adult children attributed it to her age. It was her medication. After a comprehensive medication review with a geriatric specialist, Ruth began a carefully supervised taper over 16 weeks. Within 2 months of completing that process, she described feeling like herself again, clear-headed, steady on her feet, and back behind the wheel. Ruth's story is far more common than most people realize. If you or someone you love has been taking a benzodiazepine for months or years, often started for something that was supposed to be temporary, share that in the comments. You would be surprised how many people in this community are going through the exact same thing right now. On one critical point bears emphasizing, benzodiazepines cannot be stopped abruptly in long-term users. Sudden discontinuation can cause seizures, severe cardiovascular stress, and dangerous withdrawal. The path forward is a medically supervised taper, and it is a path thousands of seniors successfully complete every year with the right support. What to discuss with your doctor? Ask specifically how long you've been on a benzodiazepine and whether your original clinical reason for starting is still the current indication. Ask about non-pharmacological alternatives. Cognitive behavioral therapy for insomnia, known as CBTI, has strong evidence behind it, as does low-dose melatonin and structured sleep hygiene protocols. And ask directly about a supervised taper plan. Be honest, did you already know that long-term use of a common anti-anxiety medication could raise dementia risk by more than 50%? Drop a yes or a no in the comments. Most people hear this for the first time and are genuinely floored. If you're finding this valuable, subscribe to Senior Health Decoded. New science-backed health content built specifically for adults over 60, every single week. Let's be direct about something before going further. Statins save lives. For adults who have already experienced a heart attack or stroke, the cardiovascular benefit of statin therapy is well supported by research, and nothing in this section questions that. But for adults over 65 who are taking statins for primary prevention, meaning they have never had a cardiac event, the risk-benefit picture looks meaningfully different. And there is a side effect affecting a significant portion of all statin users that does not receive nearly enough attention: muscle damage. Statin-associated myopathy refers to a spectrum of muscle-related problems triggered by these medications, ranging from mild aches and fatigue to a serious condition called rhabdomyolysis, the breakdown of muscle tissue that can result in kidney damage. According to a large-scale review of statin side effect data in adults over 60, up to 25% of long-term users experience some form of muscle-related symptom, most of which go unreported or are attributed to aging. The mechanism is critical to understand. Statins work by inhibiting an enzyme called HMG-CoA reductase, which blocks cholesterol synthesis. But this same pathway is also responsible for the production of coenzyme Q10, a compound essential to cellular energy production across every tissue in the body, including skeletal muscle and the heart itself. When statins suppress CoQ10 production, muscles cannot generate energy efficiently. The result is deep, diffuse fatigue and weakness, the kind many seniors describe as their body aging rapidly. This is Harold's story. Harold was 71, a retired electrician from Ohio, and he had been telling his doctor for 3 years that his legs felt like they were full of lead, particularly when climbing stairs or walking more than a few blocks. His doctor had run standard blood work. Nothing alarming came back. Harold had quietly accepted that this was what 71 felt like. What no one had connected was that his symptoms had started approximately 6 weeks after his statin dose was doubled. Harold wasn't getting old. Harold was experiencing progressive CoQ10 depletion. After a referral to a physician with a specialty in geriatric pharmacology, Harold was transitioned to a lower-dose statin, combined with 200 milligrams of CoQ10 daily. Within 10 weeks, he was back to walking 3 miles a day. Quick check for the group. How many of the conversations we've described so far have you already had with your doctor? Drop your number in the comments. 0 is a completely valid answer. That's exactly what today's video is for. What to discuss with your doctor. If you experience unexplained muscle weakness or fatigue and you're on a statin, ask your physician directly whether statin myopathy could be a contributing factor. Ask about CoQ10 supplementation. The clinical evidence is mixed, but many patients report meaningful improvement and the safety profile is well established. And if you're a primary prevention patient over 65 with no prior cardiac events, ask what the current evidence specifically shows about whether continued statin therapy is appropriate for your exact age, sex, and health profile. That is a conversation worth initiating. Number 1. Proton pump inhibitors. This is the medication that consistently catches people off guard, because most seniors taking it have no idea it's doing anything beyond settling their stomach acid. Proton pump inhibitors, medications like omeprazole, esomeprazole, pantoprazole, and lansoprazole, are among the most widely prescribed medications in the world. They're used for acid reflux, GERD, peptic ulcers, and as stomach protection for people on NSAIDs like ibuprofen. They are available over the counter. They feel benign, and millions of seniors have been taking them every day, continuously for years. Often well beyond the 8 to 12 weeks these medications were originally designed and approved for. Here is what the research actually shows. PP is dramatically suppress stomach acid production. But stomach acid is not the villain it has been marketed as. Stomach acid is a critical component of nutrient absorption, and it is absolutely essential for the absorption of 2 nutrients with profound implications for muscle and bone health in seniors: magnesium and vitamin B12. The FDA issued a formal drug safety communication specifically on this risk, one of the few clear, real-world, Tier 1 findings in today's video. The FDA's communication stated that long-term PPI use is associated with low blood magnesium levels, and that this deficiency can lead to muscle spasms, weakness, tremors, and, in severe cases, dangerous cardiac arrhythmia. What makes this particularly insidious is that magnesium deficiency develops silently over months and years. There are no obvious early warning signs. By the time symptoms become noticeable, the deficit is already significant. The vitamin B12 connection is equally important to understand. B12 absorption requires adequate stomach acid to separate the vitamin from food proteins. When PP is suppressed that acid over years, B12 levels fall, slowly, steadily, and without obvious early symptoms. In seniors, B12 deficiency produces a cluster of symptoms that is almost universally attributed to normal aging: fatigue, memory difficulties, tingling in the hands and feet, balance problems, and persistent cognitive fog. A large-scale population study involving over 25,000 adults found that long-term PPI users had a significantly higher incidence of clinically low B12 levels than matched non-users, with the risk increasing proportionally with duration of use. Bone integrity completes the picture. A clinical review published in a top gastroenterology journal found that long-term PPI users over 65 had a measurably higher risk of hip, wrist, and spine fractures, driven by impaired calcium absorption and ongoing magnesium depletion, reducing bone mineral density over time. And there is a fourth dimension now gaining serious attention in the geriatric medicine community: the gut microbiome. Stomach acid is a primary natural barrier against harmful bacteria entering the intestinal tract. Research increasingly shows that long-term PPI use disrupts the gut microbiome in ways that affect immune function, systemic inflammation, and emerging evidence suggests even cognitive health. Walter's story brings this home. Walter was 74, a retired accountant from Arizona who had been on pantoprazole for 7 years following an initial diagnosis of GERD. His reflux symptoms had resolved fully after the first year, but the prescription was renewed automatically at every annual checkup without reevaluation. By the time he requested a complete medication review from a new internist, now Walter was experiencing persistent leg weakness, severe muscle cramps throughout the night, and what his family described as noticeable new forgetfulness over the past 2 years. His blood work revealed critically low magnesium and a clinical B12 deficiency. Within 6 months of a supervised PPI taper, combined with B12 injections and a magnesium supplementation protocol, his nighttime cramps had ceased, and his family described a visible restoration of his mental sharpness. What to discuss with your doctor? If you've been on a PPI for more than 12 weeks, ask whether your original indication still requires continuous therapy, or whether you might be a candidate for step-down treatment, reducing to the lowest effective dose, or transitioning to an H2 blocker like famotidine, which carries a meaningfully different risk profile. So ask for magnesium and B12 levels to be included in your next blood draw. These tests are inexpensive, routinely available, and should be part of any long-term PPI monitoring protocol. Ask specifically, is there a lifestyle-based management plan for my reflux that could allow me to reduce or eliminate the PPI over time? Lifestyle interventions: elevating the head of the bed by at least 6 inches, avoiding meals within 3 hours of sleep, eliminating dietary triggers, reducing alcohol and caffeine, carry solid evidence for managing GERD without long-term pharmaceutical dependence. Before we move to your action steps, take a moment right now. Out of everything covered in today's video, the 5 medications, the nutrients being depleted, the conversations that haven't happened yet, what is the one specific thing you are going to act on this week? A doctor's appointment, a question you're going to ask, a blood test you're going to request. Write it in the comments right now. When you commit to something in writing, research shows you are significantly more likely to follow through. So write it down. Action steps. Here are 5 concrete steps to take starting today. Step 1. Build a complete medication list. Write down every prescription medication, every over-the-counter drug, and every supplement you are currently taking, including the dose and how long you've been taking each one. Bring this list to your next appointment and ask directly, are any of these medications known to cause muscle weakness, fatigue, or nutrient depletion in older adults? That single question changes the entire dynamic of the visit. Step 2. Request a targeted blood panel. Ask specifically for serum magnesium, vitamin B12, and vitamin D levels at your next blood draw. If you've been on a PPI or a statin for more than a year, consider these 3 tests non-negotiable. They are inexpensive, widely available, and routinely overlooked in standard panels. Step 3. Ask the original indication question for every long-term prescription. For any medication you've been taking for 6 months or more, ask your doctor, is the condition that originally led to this prescription still the primary reason we're continuing it today? Prescriptions get renewed on autopilot. This one question disrupts that pattern. Step 4. If you are on a benzodiazepine, I'd introduce the word taper at your next visit. You don't need to arrive with a plan. Simply say, I've been reading about the documented risks of long-term benzodiazepine use in older adults. Can we discuss whether a supervised taper might be appropriate for me? That conversation alone is a significant step. Step 5. Add CoQ10 rich foods to your diet this week, particularly if you're on a statin. Dietary sources include beef, sardines, mackerel, herring, and spinach. Aim for at least 2 servings of fatty fish per week. Dietary CoQ10 is safe, broadly beneficial for mitochondrial function, and costs nothing beyond what you'd spend on food you should be eating anyway. And here's the closing question for this community. Has anyone here, or someone close to you, experienced a noticeable side effect from one of the medications we covered today that was initially explained away as simply getting older? A family member whose mind seemed to be slipping, whose legs gave out, whose energy disappeared, and it turned out to have a pharmaceutical explanation? Share that story in the comments. These stories matter, and they help others in this community recognize what might be happening in their own lives. If this video gave you something actionable, a question to ask, a test to request, a conversation to start, please share it with a family member or friend who needs to hear it. And if you haven't yet subscribed to Senior Health Decoded, do it now. Every week, new science-backed content built specifically for adults over 60 who are determined to stay strong, sharp, and in control of their own health. Your health decisions belong to you. This channel exists to make sure you're making them with the right information,